Welcome to the lab. If you are over 60 and you have ever walked out of a doctor's appointment feeling like nothing useful was actually checked, this video is for you. Today we are talking about 4 specific blood markers that the most current research links directly to how fast or how slowly your body is aging. Not generic cholesterol numbers you have heard 100 times. 4 precise, often overlooked tests that give your doctor and you a far clearer picture of your biological age, your cardiovascular risk, your inflammation levels, and your long-term independence. These 4 markers could change the conversation at your very next appointment. Before we get into the markers themselves, I want to ask you something honestly. When was the last time your doctor ordered a blood test and actually sat down to explain what each number means for your aging? Not just whether you are in a normal range, but what the trajectory looks like over time. Leave your answer in the comments below. And here is a promise I want to make you right now. By the end of this video, I am going to share one final marker that virtually no one over 60 is being tested for. Yet it is one of the strongest predictors of muscle loss, falls, and early frailty that science currently knows. Stay with me. Here is why blood markers matter so much for aging. Your blood is a living report card of what is happening inside your tissues, your arteries, and your cells right now. A landmark 2023 study published in Nature Aging, which followed over 4,000 adults into their 80s and 90s, found that biological aging, meaning how old your cells actually behave, diverges significantly from your calendar age starting in your 50s and accelerates after 65. The 4 markers we are discussing today each measure a different dimension of that divergence: inflammation, metabolic efficiency, kidney-muscle interaction, and hormonal resilience. When your doctor tracks all 4 together, the picture of your aging trajectory becomes measurably clearer. Marker number 1 is called hs-CRP, which stands for high sensitivity C-reactive protein. This is a measure of systemic inflammation inside your body. Here is the key distinction. Standard CRP tests, which many doctors order, only detect inflammation at high levels, the kind caused by an active infection. The high-sensitivity version detects low-grade, chronic inflammation that simmers silently for years without obvious symptoms. And that silent inflammation is now understood by the NIH and multiple cardiovascular research groups to be a primary driver of accelerated aging, heart disease, stroke, cognitive decline, and even cancer risk. According to published guidelines from the American Heart Association, an hs-CRP level below 1 milligram per liter is considered low cardiovascular risk. Between 1 and 3 is moderate, above 3 is high. Many adults over 65 walk around with levels above 5 and do not know it. What drives hs-CRP up? Visceral fat, the fat stored around the organs, not under the skin, produces inflammatory chemicals continuously. Poor sleep, high sugar intake, physical inactivity, and gum disease are also documented contributors. The good news from a 2022 meta-analysis in the Journal of Clinical Endocrinology: even a 10% reduction in visceral fat achieved through a modest calorie deficit and 20 to 30 minutes of walking 5 days per week produces a clinically meaningful reduction in hs-CRP within 12 weeks. Ask your doctor specifically for the hs-CRP test, not standard CRP. Marker number 2 is HbA1c, glycated hemoglobin. Most people associate this test with diabetes, and yes, it is the gold standard for diagnosing and managing diabetes. But what is less known is that even in people who have never been diagnosed with diabetes, HbA1c levels in the high normal range are strongly correlated with accelerated brain aging, arterial stiffness, and kidney decline, according to data published by the Mayo Clinic and supported by findings from the Framingham Heart Study. HbA1c tells you the average blood sugar level over the past 2 to 3 months by measuring how much sugar has attached to your red blood cells. A normal range is below 5.7%. Prediabetes begins at 5.7 to 6.4. Diabetes is 6.5 and above. But here's what many doctors do not discuss. Research from Alzheimer's research journals shows that even at 5.4%, still technically normal, there is a measurable increase in amyloid plaque formation in the brain compared to levels at 4.8 or below. This means the conversation about blood sugar and aging should begin well before a diabetes diagnosis. Practical steps supported by the NIH: replacing refined carbohydrates with fiber-rich vegetables, legumes, and whole grains, sleeping 7 to 8 hours consistently, and doing any form of resistance activity, even chair-based exercises, can lower HbA1c by up to half a point within 3 months. That half point matters. Marker number 3 is eGFR, estimated glomerular filtration rate. This measures how efficiently your kidneys are filtering waste from your blood every minute. Most people do not think about kidney function until there is a problem, but here is why it matters for aging specifically. Your kidneys and your muscles are in a constant biological conversation. As muscle mass declines with age, a process called sarcopenia, the kidneys receive less creatinine, which can artificially make eGFR look normal even when kidney function is actually declining. The National Kidney Foundation recommends requesting a Cystatin C test alongside eGFR in adults over 65 because Cystatin C is not affected by muscle mass and gives a truer picture of kidney function. A healthy eGFR is above 60 milliliters per minute per 1.73 meters squared. Values between 45 and 59 indicate mildly to moderately reduced function. Below 30 is seriously reduced. Why does this matter for aging? A declining eGFR means your body is less able to clear inflammatory waste products, medication byproducts, and excess minerals, all of which accumulate and accelerate cellular aging. Studies from the National Institutes of Health have shown that adults with eGFR values consistently below 60 have significantly higher rates of cognitive decline and cardiovascular events, independent of other risk factors. Protecting kidney function comes down to 3 well-documented lifestyle factors: staying consistently hydrated, around 6 to 8 glasses of water daily, reducing processed sodium below 1,500 milligrams per day, and avoiding chronic NSAID use, such as ibuprofen, without medical supervision. And here's the marker I promised you at the beginning, the one that virtually no one over 60 is being tested for, yet the evidence behind it is compelling. It is called IGF-1, insulin-like growth factor 1. IGF-1 is produced primarily in the liver in response to growth hormone signals, and it plays a central role in maintaining muscle mass, bone density, and cellular repair throughout your entire life. After age 60, IGF-1 levels decline by approximately 14% per decade in most adults, according to research published in the Journal of Clinical Endocrinology and Metabolism. And that decline is directly linked in multiple large-scale studies to accelerated muscle wasting, increased fracture risk, and greater vulnerability to metabolic disease. Here is what makes IGF-1 so important as a diagnostic marker. It gives your doctor early warning, often years before a fracture, a fall, or a muscle loss crisis, that your anabolic, meaning tissue-building capacity, is declining. A normal IGF-1 range for adults over 60 is roughly 75 to 175 nanograms per milliliter, though laboratories vary. Values persistently below 75 are associated with significantly poorer physical outcomes. The good news from a 2021 systematic review in nutrients: adequate dietary protein, at least 1.2 grams per kilogram of body weight per day, combined with progressive resistance activity, even when done seated in a chair, meaningfully supports IGF-1 levels and slows the decline. Here's a safe, effective exercise you can do right now from your chair. It is called a seated knee extension. Sit tall in your chair with both feet flat on the floor. Breathe in slowly through your nose. As you breathe out through your mouth, straighten your right leg until it is parallel to the floor. Hold for 2 seconds. Breathe in again as you lower it slowly back down. That is 1 repetition. If knee pain makes this difficult, reduce the range of motion. Just lift your foot a few inches off the floor rather than extending fully. The muscle activation still occurs. Do 10 repetitions on each side, twice daily. This simple movement over time signals your body to maintain IGF-1 production and preserve the muscle that keeps you independent. I have summarized everything on the screen right now. Take a screenshot right now or download the free guide from the description below. The summary shows all 4 markers: hs-CRP, HbA1c, eGFR with cystatin C, and IGF-1, along with the optimal ranges and the exact words to use when you ask your doctor. Think of this guide as a conversation tool, not just a piece of information. When you arrive at your next appointment with those 4 names written down, you immediately change the quality of that conversation. Your doctor can focus on what matters for your aging trajectory rather than running through a standard checklist. Many people who keep a copy of this guide by their bed or on their phone say they feel more in control of their health, not because they have all the answers, but because they know the right questions. That is where real preventive care begins. And knowing the right questions is exactly what we focus on every week here at Lifespan Lab. To keep this progress going, click the video on your screen right now. It is the perfect next step for your body. Subscribe to the lab. Stay strong, stay safe.